Right now, we want to talk about the bio convention that's taking place in the district. All across the country and all across the world, scientists are hard at work using biomedical research to improve both the quality and the length of our lives. We'll talk with a participant in this week's conference in just a moment, but first, let's get some background from our Kathy Park.
For members of the biotech industry, this is a place to be and to be seen every year.
We have about 20,000 people from 65 countries here from all aspects of biotechnology. These are the people who are coming with the cures for debilitating diseases, for alternative energy sources.
This year, the annual Bio International Convention is happening at the Washington Convention Center, an event that Governor Martin O'Malley says he never misses. 1/3 of new jobs in Maryland have come from bioscience, and it's an industry at the forefront of his administration.
What I hope to accomplish here is to build upon the awareness around the world of just what Maryland has to offer.
The MD Bio Lab, a tool to teach high school students about research and science, is one example of how the Free State is expanding its reach.
We see about 35 high schools a year, maybe 10,000 kids. On Monday, we set up our truck. We bring the kids through on a schedule that the teachers tell us. We have a menu of activities they can choose from.
This mobile learning environment is one of many exhibits at the convention where attendees can share, learn, and connect.
If you think the 80,000 parts on a race car or something, you got to see what it takes to put clinical trials together.
Healthcare company Novo Nordisk used a race car to get its message out. Others took a sweeter approach.
This is a genetically modified papaya to resist the papaya ring spot virus.
Mark Herzog with the Virginia Biotechnology Association says the resources available all under one roof can lead to future partnerships.
They can go off and meet with venture capitalists, with other companies looking for joint venturing opportunities. And so those tools are essential for them as they make their case to the world's life sciences.
This is the second time the convention has come to D.C., and while it's in the nation's capital, an important discussion will take place Wednesday, and that's the future of healthcare reform. In Northwest, Kathy Park, News Channel 8.
Joining us now, joining us now from our News Channel 8 studios, Seth Ginsberg. He's head of the Global Healthy Living Foundation. They're participants in this week's event. Seth, good to have you here.
Good to be with you, Bruce.
Give us a sense of the excitement that must be in the room at the convention center, given all the great work that's taking place in labs and in other places all over the globe.
Well, there is an awful lot of kinetic energy this week here in Washington around life sciences, around the biotechnology industry. And as patients and as a patient advocate with the Global Healthy Living Foundation, it's a privilege to participate in this conference because we understand the importance of innovation in medicine. We're the folks who rely on it. We're the folks diagnosed with chronic illnesses that in many cases can be addressed and sometimes even cured thanks to the innovation that's occurring in the biotechnology industry. So it's really cool to be here.
Kathy gave us a sense of some of the people and innovation that she encountered. Give us a sense of some of the things you've seen and that have been eyebrow-raising for you.
Well, they're definitely figuring a lot of stuff out. 2011, I mean, we're in the future, basically, with respect to healthcare and innovation in medicine. And it's great to have a chance to be able to reap those benefits as patients living with anything ranging from a systemic autoimmune condition like rheumatoid arthritis to some much more life-threatening conditions like cancer. And the innovations that are occurring right now in the industry are amazing, but they also highlight a lot of issues that concern us as patient advocates, and that's access to this care. The U.S. are leaders. The United States is a leading country in the biotechnology industry, and we're proud to be a part of that lead, but we're also anxious and we're weary of ways that are basically barriers to care, and that's exactly what the Global Healthy Living Foundation is in attendance to address.
Seth Ginsberg, head of the Global Healthy Living Foundation. So many people live with illness, with aches and pains, with things that keep them from being mobile or simply enjoying life to the full. Our grandparents, our parents, us and our kids, it seems, are all going to have better lives because of the advances that are being made. Is there a downside in terms of expense or other things that temper what is otherwise a really promising environment?
Well, first of all, at the Global Healthy Living Foundation, which encompasses a number of disease-specific communities like creaky joints for people living with arthritis, we're constantly remaining positive. We want the public, especially our members of our organization, to know that the future is very promising. With that, and to address your specific point, yes, it's definitely an issue. And for us, especially today, given the climate that we're living in, and deficit reduction being such an important issue here in Washington and around the country, we're seeking ways to promote the benefits that our healthcare system has, as well as some areas that need fixing. And these areas might include issues like fraud and abuse. These areas might include things that don't exactly account for preventive medicine, things like diet and exercise that the Global Healthy Living Foundation stresses so much. And so there is a little bit of disparity between innovation and access to care, and that's a gap that we're trying to close at the Global Healthy Living Foundation. And we're joined by many other advocacy groups and patients all around the country to address this very issue.
We only have a few seconds left. Can you address what's a key part of this broader picture, and that is that all of us make the best choices we can so that we don't get sick or have a physical breakdown in the first place?
Yeah, you know, it's all about staying positive, and it's all about taking initiatives to stay healthy, whether it's diet, or exercise, having a positive mental outlook, a productive relationship with your doctor. And that's exactly what Global Healthy Living Foundation, Creaky Joints, and our other web communities are all about. So we encourage the community, the public, to check us out online at GHLF.org, or follow us on Twitter, GHLF.org, because we're eager to engage as many people as possible, to teach them about ways they can stay healthy, and then of course to advocate for improved access to care.
Seth Ginsberg, thanks very much for your time. Enjoy the rest of the conference. We appreciate you coming in to be with us today.
Thanks, Bruce. Good to be here.